Don't have an answer for you tonight. We'll keep answering your questions each night here at 7 o'clock. Tonight Oregon has close to 700 cases of coronavirus, and more than 30 of those infected are healthcare workers. Joining us now as our live guest is Dr. Jennifer Vines, a deputy health officer for Multnomah County. Dr. Vines, thank you for being here with us. What are your thoughts on those latest numbers?
I think I'm sad but not surprised to see numbers climbing as more testing comes online. Healthcare workers live in our communities. We know the virus is in the communities. So again, it's not surprising to me that we're finding some positives in that group. I am glad that they're getting tested.
According to your most recent data, is the social distancing and the stay-at-home order working? I know it's still early, but, does the data or numbers, does it tell us anything yet?
So it is very early to say, and there are a lot of drawbacks to modeling in general as far as how reliable it is. I would say there's room for some cautious optimism. That said, as a public health officer, I am continuing to plan for a worst case scenario and for a wave of illness that is predicted in sometime in the month of April.
Yeah, I mean, is it possible that we will, flatten the curve and not see that huge increase of cases in Oregon hospitals?
I think it's possible, and that's certainly what I'm hoping for. But again, I'm not planning on it. I'm planning for the alternative, and if those plans aren't needed, I'll be thrilled.
Right, planning for the worst. And we keep hearing from national experts. We do a lot of interviews on this show, and many of them have said that the worst is still 2 weeks away. Do you agree with that assessment for us here in Oregon?
I would agree. Our planning assumptions are based on the idea that a wave of illness is probably coming in the next 1 to 2 weeks. Again, to what extent and how bad that wave is going to be, how long it lasts, I'm not sure we can predict. I do feel good that we put in place social distancing measures early on, which is by far the best way to really keep that wave from just overwhelming us. So again, I'm optimistic, but also making plenty of alternative plans should we get surprised.
Right. What else has the data shown about COVID-19 here in Oregon?
So a few things. Multnomah County, along with several other county partners here in the metro area, launched a data dashboard that anyone listening can find at multco.us, COVID-19 data. And it shows us some of the case counts here in the Portland metro area. It tells us a few other things as well. It tells us that of the people who've tested positive, about a quarter were hospitalized. Again, these are early times, so those numbers may change. It also, unfortunately, shows us that the groups that are testing positive really span the age range, including those hospitalized. So that is another reminder that even if you are young and healthy, again, with nobody having immunity to this virus, everybody needs to take precautions for themselves and for others.
Right. And, as deputy health officer, what can you share about testing and the availability of testing for people in Oregon?
So in general, I know that our Oregon State Public Health Lab, which was the first to come online, continues to do testing there. Several health systems have brought testing online. And in general, they continue to focus on people who are sick enough to be hospitalized with what looks like a viral lung infection as far as prioritizing testing. And they are increasingly offering that testing to their healthcare workers and to others who are not sick enough to be hospitalized, but who may have the virus.
And I know you did mention, young people. Is that still a concern? Do you think that young people are taking this seriously? I know the messaging in the beginning was that the elderly, should be worried, should be concerned about this, but then we really did see that change. What can you tell us about that?
Yeah, I think there's a strong emphasis on the elderly because when you look at Oregon deaths, sadly they do fall into the higher age range, people in their 80s and 90s, many with underlying medical conditions. That said, there's a range in this illness of people who can get sick and who are sick enough to be hospitalized, and that can reach down to people well under 60, which is considered the age cutoff for being high risk. So I think, again, anyone listening should be cautious, and especially those with underlying medical conditions should be taking all the precautions, again, not just for their own personal health, but for that of others.
Great. Dr. Vines, thank you so much for your time and for, being here with us tonight to answer some more questions.
It's my pleasure. Part of our role in public health is getting good information out as quickly as we can. Again, it's a rapidly changing situation. So I'm happy to be here tonight to share the best of my knowledge and at least what we know today.
All right, great. Thank you so much again, Dr. Vines. All right, let's move on now to some questions that we've been getting about unemployment help. The $2 trillion relief package expanded unemployment insurance benefits, but we're still hearing from a lot of confused people. People have a lot of questions because they're having trouble applying for unemployment. Lindsay Nadrids has some answers for you.
The Employment Department says they're doing everything they can to make this process easier. They've added more people to take phone calls. And if you go to their website, you'll now see this entire section that's dedicated to COVID-19 related business layoffs, closures, and unemployment insurance benefits. Here you'll also find 2 videos that walk you through how to file a claim and answer specific questions.
This video will help you navigate the new claims application during this statewide emergency.
I also learned that if you already filed a claim but think your benefits will be different because of that relief package, you do not need to refile. The Employment Department says it will process the claim you already filed and will go back and send additional payments for any week's federal benefits applied. We'll post more information about this on kgw.com.
All right, thanks, Linz. This is an especially difficult time for local small businesses. Many have asked, if they do accept federal money, will they have to pay it back? Danielle Kane at the Better Business Bureau has that answer.
Yeah, so I think the one thing that is really good for small business owners to know is about the loan forgiveness end of the stimulus package. So for the small business owners that do get approved for an SBA loan, what's interesting is that the bulk, I don't want to say all, but a good portion of those loans the SBA is saying will be forgiven if that business stays intact and continues to employ its staff, during and after the crisis. So if the business stays afloat, there's a chance that loan will be forgiven.
Good to know. This health crisis has us all learning a lot of medical terms. You wanted to know what a super spreader is, so we found the answer. But first, here's a question from you. This person wants to know, I work in retail and live with my elderly grandmother. Should I self-quarantine even though I have no symptoms of COVID-19? The answer, anyone living with a high-risk individual should seriously consider going into quarantine with them. Asymptomatic people in their 20s have been identified as super carriers, people who very easily transmit the virus to others without showing symptoms themselves.
Please donate to the KGW Great Food Drive at the Safeway checkout today.
I think there's a lot of positive that's coming out of it. People helping one another.
I think it's a sign of mankind trying to pull us back together and make sure we work together.
Keep your head up. It won't last forever.
Now for a question we've been getting nearly every day. Can UV light kill the coronavirus? Columbia University researchers say that broad-spectrum germicidal UV light can kill bacteria and viruses. But here's the catch. It's done with robots. It's very dangerous for humans. That's why the World Health Organization says UV light is not a safe way to kill coronavirus. Our next question, what is a super spreader of COVID-19? A super spreader is someone who infects more people with the disease than the average person does. An example is recently there was a conference held in Boston, and that's believed to be the source of most of the coronavirus cases in Massachusetts. Of the 138 cases in that state, 104 are linked to the conference. Experts still aren't exactly sure how super spreading works in the coronavirus pandemic. The CDC says the phenomenon could be the result of a combination of host and virus environment and virus interactions. And our next question, do vaccines against pneumonia protect you against the new coronavirus? No. Vaccines against pneumonia do not provide protection against the new coronavirus. The virus is still so new and different that it needs its own vaccine. Thank you so much for sending in your questions. We will do our very best to answer them every night at 7 to 7:30 in our special coronavirus Q&A show. You know, one of the big problems Oregon has and many other states are still dealing with is this lack of testing. I asked NBC News science contributor Dr. Joseph Farrer about what's being done to change that.
We're still really far behind with regards to being able to test everyone. Right now, we're still only testing the critically ill and those with in the high-risk categories, the elderly with underlying conditions, or younger people with those underlying conditions as well. So you're going to have to be pretty acutely ill or have demonstrated symptoms or have known contact with a COVID-19 patient to meet those testing criteria as they stand now. And tests are still in limited supply. You hear that everywhere. So we're definitely behind on nationally where it comes to diagnostics. However, there is positive news. You know, there was a new recent rapid test approved in the last couple of days by Abbott Diagnostics, one of the major diagnostic manufacturers in the country, that brings into line at least 4 major commercial diagnostic manufacturers. So it's improving, but we're still not where we need to be. And I should point out there are 2 types of tests. There's the acute test, and that's going to tell you if you currently have COVID-19, and that's the nasal swab that we keep talking about and the oral swab that we keep talking about. And then there's an antibody test that will tell you if you had COVID-19. And that's important because we've talked about, you know, potential treatments. One of the first one is convalescent serum. That means you've had COVID-19, you've recovered from it, and you're actually producing protective antibodies, which we can then transfer into an individual that is acutely ill with COVID-19, helping them overcome the infection.
Is there anything else you want to add? You know, like I always say, you always, you know, tell it like it is. Is there anything else you want to say before we leave here?
Well, you know, this is not to be pessimistic, but things are going to get a lot worse over the next few weeks. Anywhere from 3 to 6 weeks from now is when we expect to see the peak in the New York and honestly nationwide of COVID-19. I think you saw probably recently that Dr. Fauci and Dr. Birx have estimated 100 to 200,000 cases, or deaths rather. And that's using best case scenarios where everyone is doing the same thing. We know at least 50% of the states are not doing the full shutdown, and 50% of the states are doing the full shutdown. So until we all do that and do it all at the same time, we can probably expect to see more deaths than that.
All right, up next, a number of you asked whether asthma inhalers or nebulizers could make COVID-19 symptoms worse or potentially spread the virus. We have that answer. But first, if you're wondering how much you'll get from the $2 trillion emergency stimulus bill Congress just passed, we've made it easy to get that answer. Text the word check to 503-226-5111. We'll send you a link to a stimulus check calculator. Don't call the number, though. Just... You know, some viewers have asked us to verify if asthma inhalers or nebulizers are safe to use right now. So we had our Verify team dig into the question. Our Jason Puckett joins us with the answers.
The CDC does say that people with asthma may be at a higher risk of getting very sick from COVID-19. And a number of you asked us whether asthma inhalers or nebulizers could make COVID-19 symptoms worse or potentially spread the virus. To answer, we went straight to the CDC and the Asthma and Allergy Foundation of America. Let's break this into 2 quick questions. 1, will my steroid medication cause issues? No. According to the AAFA and CDC, corticosteroids are not a risk for people with asthma right now. They recommend you keep taking your prescribed medications, and that applies to pills, nasal sprays, and inhalers. Second question, can inhalers or nebulizers spread the virus? For a quick explanation, inhalers are those small devices that deliver meds through puffs you inhale. Nebulizers are larger and actually turn liquid medications into a mist you can inhale. The AAFA says inhalers are fine and should be used when possible, but they do say nebulizers could increase the risk of spreading the virus. That mist that's being created could carry the virus if someone sick was using it. Now, that doesn't mean you can't use a nebulizer, especially if you need one because you're having an asthma attack. The AAFA just says to be cautious and consider limiting the number of people in the room. If you've got more questions for us to look into, send us an email. With your Verify, I'm Jason Puckett.
And up next, an answer to the question you may ask yourself every night: what is something healthy to make for dinner while stuck at home? But first, a viewer question. If one family member gets the virus, what should the other family members do? Should they stay away from the room where this patient is quarantined? The answer: doctors recommend if a person is sick in your home, they should have their own room, own utensils, own bathroom if possible. Communicate with your doctor often and seek medical treatment if things get worse or they have trouble breathing. A lot of people might be asking themselves, how do I eat healthy while staying at home? So we asked a nutritionist for her tips.
My name is Allie Bourgeray. I'm a holistic nutritionist here in Portland, Oregon, with a business called Shifting Nutrition. Immune boosting foods right now, vitamin E and vitamin C, are going to be really important, to be incorporating on a daily basis, not just here and there, but getting in as much as we can to really have a good effect on the body. So really what you want to think are your red, your green, and your yellow foods. Things like broccoli, red bell peppers, spinach, garlic, ginger. Cooking with those things really going to add a good punch of immunity boosting. This is actually my morning wellness shot. So I put it in a big jar like this, and I just take a little bit of it every day. So it's any juice that you want, apple cider vinegar, fresh lemon, and then I add oil of oregano as well. So that's really high in, it has antiviral, antibacterial properties. So obviously right now that's going to be huge. But I would honestly suggest still meal prepping if that's something that you normally do, or maybe start making that a habit. That way you know exactly what you're going to be grabbing out of the fridge for lunch, and you're not so just mindlessly snacking all day long. You can kind of get in a good routine. Right now, I love to make a homemade trail mix. So any nuts and seeds, and throwing some chocolate chips in there as well. You can kind of control, obviously, everything that you love to make that a good mix.
Those are great tips there, and she has some more recipes at shiftingnutrition.com. Thank you so much for joining us tonight. Every night, we're working with a team of producers, doctors, and health experts to answer your questions about COVID-19. Now, if you still have questions even after watching the show, our past stories may answer them for you. Go straight to kgw.com/factsnotfear to get caught up on all the latest information, and you can watch some of our previous reports. Please keep sending in your questions. You can find us on social media, Twitter, Facebook, Instagram, or you can email callkristen@kgw.com. Thank you again so much for joining us.